In medtech, the difference between a good quarter and a great one isn't always the product. It's the friction standing in the way. Broken sales cycles, misaligned teams, deals that stall at the finish line. Every leader feels it, and the best ones know how to remove it. Welcome to Zero Friction, the podcast where we go inside the minds of medtech's top commercial leaders to uncover the real barriers they face, the decisions they make, and the systems they build to keep the revenue moving. I'm your host, Terry Kuchaluchis. Let's remove some friction. Well, welcome, Zero Friction Podcast Nation. Terry Kuchaluchis here. And I have a really exciting day today. And we're going to be interviewing Stephen Rouse, who is representing, and he's the co-founder of Savva AI, which is a phenomenal company that has a health app, which, by the way, I'm using and having a blast with. But a little bit about Stephen. He's a serial entrepreneur, and he's got some great stories on how he actually got into the game. He's a global traveler. He's done the biotech thing. He's done SaaS, and he's now the co-founder of Savva, a platform that's designed to give every person on the planet a real portable sort of health record that they can take wherever they go, and they can do it for about $10 a year. So, with that, I'm going to hand the reins over to Stephen and have him give us a little story about himself, and then lead into Savva. So, Stephen, welcome to the program.
Thank you, Terry, for having me. Super excited to be here. Couldn't said it better myself in terms of explaining Savva. Through and through, I'm more of a sales guy than anything else over my career. I lean on my co-founder, Amit Shah. He's a technologist, and I'm the growth, sales, and marketing strategy engine of Savva. I'm really looking forward to today's conversation.
Well, that's awesome. Well, how did the concept of Savva even come to play? So what was the sort of the inception behind the technology and the platform?
Before it was an AI tool, before we fell into that bucket, so to speak, Amit and I were working on a QR code solution where all over the world we could digitize someone's health records by ingesting a unique QR code that maps to their longitudinal health record. You could scan a QR code, and without access to the internet, if you're in a low resource setting or maybe in a basement of a hospital somewhere, without any network, that data could go from that QR code over to your phone and be held locally on the device. And then we started looking into what had happened to health records and to the regulatory landscape with health data in the US. And we're surprised to find that you could use FHIR to extract EHR data and have people credentialize themselves. And so we kind of pivoted into this, okay, what if you could get, health records ingested, and then looked at wearables. I've got my Whoop on right now, and I'm a big Garmin user and an Apple Watch user, and use Strava my whole life pretty much for skiing and cycling. And what if we can ingest all this information in one place and keep the philosophy of on-device storage and try to do everything as safely as we can in terms of keeping it out of the cloud? And so it's kind of transformed over the past 24 months or so into what Savva is today. And I think at the end of the day, right, we're trying to provide a tool, an affordable tool to people to make better, more informed decisions on their health, from a longevity perspective, to make healthier decisions so you can live longer and feel better.
That's awesome. So do you have a healthcare background? Does Amit have a healthcare background? How did you kind of stumble into the health space?
So Amit is a genius technologist, and he always calls himself the fraudulent doctor. He's not a doctor. A lot of his relatives are. I have the furthest. My background is the furthest from a medical background.
Give us a little background on yourself too, by the way, because I think that's a really interesting story. I'm going to segue quickly into you because I think your first engagement into the entrepreneurial setting is a really fun one.
Yeah, speaking of far from healthcare, if we were having this conversation 15 years ago, I would be jokingly calling me the Christmas king of the West Coast. I developed, when I was in my early 20s, an oversized Christmas light. They were about 2 feet tall and powered by LEDs. And I came to market via Kickstarter, but before all that really happened, I showed up unannounced at Home Depot's corporate headquarters with my sole prototype and walked away with a purchase order and signed this thing before I really gave it a good look. It was, I don't know, 100 pages long kind of thing. And as a 22-year-old entrepreneur, to sign this thing, was so excited when I saw the dollar signs on it, of course. Quickly found out, like, oh my goodness, I probably need to move to Shenzhen, China, like in order to get this order fulfilled. So it's a super long story, but I got into, my first entrepreneurial journey was through Christmas lights, and had a pretty good run
Not
for.
just Christmas light, but like massive Christmas lights, by the way. Like not like I just want to make sure we get everybody's brain set. They're like the size of a pineapple or bigger,
For
probably.
sure, yeah, like a rugby ball. They're like this big. And, being a creative genius that I am, I named the company and the product Really Big Lights. It seemed to make sense, and there's millions of them all over the world now. I sold them to all sorts of retailers in 9 different countries over a 3 to 4 year span, and then as quickly as it kinda took off, I came to an abrupt halt in the form of, the sheriff showing up at my bookkeeper's, office here in California, and was sued for something called prior art on a patent that I had and I enforced. Was sued for prior art on my patent by some big name Chinese trade companies, and it all happened all at once, and I was super sad that day, and I'm a pretty happy-go-lucky guy.
Guy. Yeah.
Um, and so I went to Japan to do what I love most in this world, other than my wife and son. And I went skiing by myself, and I met a gentleman on a chairlift who presented a biotechnology opportunity to me on this chairlift. And I was like, oh, that translates big Christmas lights to biotech. And
There you go.
he was from England, and he made a funny, comment. I'll never forget it. And hey, mate, there's only one thing. You've got to move to Berkeley, California. I was like, bro, I'm from Sonoma. It's like 45 minutes from my parents' house. And so it was an easy sell. And so I said goodbye to the Christmas lights that day, essentially. And a couple weeks later, I was working in this, kind of, for lack of a better word, sexy biotechnology,
There you go.
just leading sales efforts.
That's awesome. So Christmas lights to biotech, and now we're at Savva, and we'll get back on track with this one because I think it has great potential just in the world of connectivity and care for people. People are trying to take control of their own health care, not going to doctors' offices, not going to hospitals as much as possible, and getting care delivery and alternative channels more than they ever have before. I think this sets up really well for your company and your platform.
Yeah, I mean, amen. We're trying to skate where the puck's gonna be a lot, in a lot of what we've been doing over the past 24 months, and it just seems like every day more dominoes keep falling in our direction. And so it's our first foray in consumer facing tools, right? We've been in the B2B space for the past, couple of projects that I've been a part of. And so it's awesome it's, less conferences, less third party risk assessments and committee approvals. You have to deal with healthcare and pharma. But then it's like you're starting a restaurant. It's like every individual has their own kind of take and spin on what they're looking for in this pretty busy category. And so it's, give or take, which one would you prefer? And so, yeah, we're really excited. We're launching soon, right? iOS has finally, we've been approved, and just waiting for Android to be green lit. And we've got it built now in 40 languages and launching in 70 countries, have a bunch of influencers from all around the world that I meet with on a daily basis, trying to evangelize them and get them on the app, testing it. And so, fingers crossed here in the next month or two, we'll be live and out there and helping transform healthcare globally, not just, here in the States.
So how do you have you identified what your ideal customer profile looks like? And is it you know I know it's going to be different in different markets, but I'm sure there's demographics that kind of segment like people that are more interested in this type of data and platform than others. So how does that work for you?
Yeah, super good question. I mean, I was on the phone this week with some folks from AARP, and chronically ill people, the older you are, the more likely it is you have one or more chronic conditions that you're managing. I think that would be, the ideal customer profile would be someone in their, 40s, 50s, 60s, managing a chronic condition that's also rocking a fitness wearable and, using data to evangelize themselves and to become, owners of their own health data and start making decisions, like you said, outside of the doctor's office. And so I'd say, especially here in the States, it'd be that ICP. Across the world, we have this saying that we've been using the last couple of weeks now that, what about the 6+ billion people without a concierge medicine doctor, right? It's not, as of right now, it's kind of like you got to have some money, or you're from you have a health system with a really awesome electronic health record. What about someone who's, still on paper, and where in a region of the world where EHRs aren't going to exist in my son's lifetime? Not like we're used to, here in the States, not at $1 million+ a build. Digitize those health records for the first time, and to bring the same safety and security and privacy angle that we have going in the States, whereas we don't have any servers at Savva. There's no accounts. Nothing is ever, out floating around there in the cloud to be sold or brokered, or we're not going to play the data game with this anywhere in the world. And so trying to bring that same kind of power to anyone, wherever you are in the world.
That's awesome, because I know a lot of these health apps are, it's all about, there's a front end model, which is the cash driving model. And then there's the back end model, which is the data model, which is the asset of the company. And I can tell you, just from, my brief experience over the last 30 days, and by the way, thanks for giving me sort of a beta version to try out. I've had a blast with it. And, I rock a Garmin, and I use Strava, and I use Apple Health, and I use Hume, and I use all these things. And it's the one platform for me that actually, and I can tie it to my EHR, and I'm taking a GLP, and I'm on TRT, and I can plug all that stuff into Savva. It recognizes it, and it helps me make sure that, like, with the GLP, you lose muscle mass. So, eating proteins are a really important part of my day, and I'm using that to monitor what my food intake and what my nutritional intake looks like. So if I'm at the end of my day, or if I'm at the end of my week and I'm short, then I can turn in a direction and change my diet, because it needs to do those things. And so I've used it in ways where it monitors my activity, it's monitoring my heart rate, it monitors my sleep, gives me green lights all over the place if I'm doing well. If I'm not, it'll give me a yellow light. If I'm red, it'll give me a red light. And it's a real simple thing to follow. And then when you start supplying it with your actual health record, which, monitors all those other things and pulls all that data in, you know, I'm fortunate enough, I'm not on a bunch of medications because I have a chronic disease, or I'm getting older, I, whatever, heart statins and things like that. But I definitely think where getting that information in there and having people taking control of their own health, which is really about healthcare is going these days. Like, it's no longer reactive health, it's more strategic and proactive health. And that's how you stay healthy. That's how you live longer. That's how you stay out of the hospital. And I think this plays right into that. That's why I ask you, like, how are you going to go get the customer? Like, that's I think influencers is always a great track, right? And my guess is probably the healthiest people are the ones that are probably using this more than ever than right now. But I think that has a chance to really expand out on that.
You know, Terry, it's super validating to hear use cases like yours, and over the past, the beta has been live since March. And my favorite thing to do, and almost on a daily basis, I get one or two meetings, getting to talk to beta testers, go through their use case. And I mean, from the weight loss and the TRT angle that you're on, I mean, there's so much of that happening right now across healthcare. A lot of people empowering themselves to go down these journeys, and I mean, that's the goal, right? It's a one-stop shop. Instead of having all those fitness apps and all the EHR records and being able to go between all these different apps and platforms, you have kind of a one-stop shop. here at Savva. And I mean, I love hearing that. It's like whew, being an entrepreneur could be a little tough sometimes. And the validation coming from actual users talking like that, man, I appreciate it. It gets a little, add some fuel to the fire for sure. Especially on a Wednesday, as summer's kicking off, you're going, man, I hope I'm spending all this time and energy doing something right. And I think you're absolutely right. You know, from the value, whether you want to call it value-based care or preventative care, that's what this shift in consumer health has been over the past 4 years or so. It's all aligned with empowering users to take control of this data, to own it, and to make decisions on their own based off the data that they're seeing. And so, again, I love hearing that from you.
It's awesome. I think, just, the GLP side, like peptides is a $90 billion market in the US today.
Wow.
Eli Lilly sells $36 billion worth of GLP-1 a year. Just, that's just a macro health perspective. And that's, there's a lot more gray matter, gray market product that's coming through that stuff too, that are powders and they're marked as peptides and all kinds of things. And so, I just think that, those types of things, monitoring your health, the aging demographic, you're now going to have people aging that are actually that have been using phones for their whole life. So you have people in their 60s and 65 and 70 that they have a higher correlation of using a device like this to track their health versus, like my parents are in their mid 80s and like I think it would be challenging for them to use an app like Savva successfully. But you're coming into a demographic right now that's getting ready to start that aging process that has technology familiarity and will easily adopt to this stuff. So that's what the exciting part for me. So how do you like once you get them, like what is it like? Is your business model the consumer? Is your business model the physician, the hospital, the healthcare market? Like how do you view yourself in terms of you know who you're really trying to serve?
I mean, consumers, right? It's a B2C to B business model. It starts with the consumers. All the things we want to do on the B2B route, you really can't do any of it without population density in the app. And so it's kind of a catch 22, maybe if that's what it is. It's you kind of I need organic growth in the app to do the things we want to do with, chronic disease management and working with a healthcare institution or a payer somewhere way down the line or even a pharmaceutical company. Right now we're keeping, we have the security and privacy net, if you will, in terms of, hey, feel safe talking about this stuff in the app. Feel safe sharing it with your friends and it's kind of yours. But then one day, I think the goal on the clinical trial side of the business, right? If you were to receive a push notification one day from the app, hey, would you be interested in, sharing this data with a pharma company in exchange for copay reimbursement or drug coupons? I think that's where I see the app going in the future. I think that, I love the Calm app. I've been using the Calm app for 10 years now. And if you're familiar with those guys, it's kind of, I come from the school of thought. I think anyone who says they can meditate, I don't believe them. I don't understand. But it's as close as I can get to meditating, right? The like forced meditation kind of for 20 minutes a day. And, when my wife and I were walking out of the hospital a couple of years ago when my son was born, UCSF here in the Bay Area was like, hey, you get Calm for 4 years on us. I went, wow, what an amazing tool, right? And all that's just a business relationship that's going on between that healthcare institution and the Calm guys, I'm assuming, right? It's just instead of, just buying bulk subscriptions and giving it to their users for free. That's where I really think if we win this race that's happening right now all around us, I think that whoever's trusted by the healthcare organizations be like, okay, look at these guys. They're not harvesting your data on the back end. They're providing a valuable tool to make you healthier decisions in between visits, if you will. That's where I think we'll really, find the just boosting, our user growth. And, with that, our revenue at $10 a person per year, we're trying to make this inclusive for everybody, which is wild, is right. Just to use GPT Pro or Claude Pro or
That's half
all
the price of a month right there. Like,
that for a year. And it's a cup of coffee in some places. If you're in, San
San
Francisco,
Francisco.
it's,
Yeah.
it's cheap. It's the cost
Your
of
$11 latte, right?
a year. Exactly. And so, but with that, right, our business model, we won't send ads, right? At $10 a year, it's tough to send ads. And also I think I get ads all the time from, similar companies going, "Hey, are you managing a chronic disease? Do you wear a wearable? Do you want to share your data with a robot?" I'm like, "What? Get out of here," right? I think it's an odd ad to receive. Plus, there's at $10 a year, we really, for lack of a better term, we can't afford ads and we don't want to. So that's why we're kind of relying on organic growth. And we have about 3,000 people almost on the beta today, all over the world. People in Nepal and Pakistan and Tanzania and all over the place, kind of using it in all sorts of different ways. And
What's the craziest thing that they're doing right now? Like, what's the craziest sort of version of what you're finding out on the beta? Like, what do you kind of go like, wow, like I would have never thought of that before?
I was on the phone with a gentleman from the Democratic Republic of the Congo last week, and older guy, they show up with binders, right? Just like my grandma used to do, right? Like their health record is just like stapled in. Here he goes. And he had gone through, and we have an on-device OCR. Where it doesn't touch the cloud. It's super sweet where you could scan. And he had created an entire longitudinal health record that went back 30 something years. Yeah. I would show it to me. And right. I mean, he like tracking biomarkers that were, on black and white kind of printouts and some handwritten notes that he had written. He'd gone every kind of page. I went, wow. Someone in that setting in Kinshasa, I think he's where he was at. And to have, hey man, you've got Epic. You might as well have a full longitudinal health record via Epic or Cerner or Athena, one of these leading guys, and you did it all yourself. You digitized it, and giving that person the same amount of, all the AI models we're connected to, and giving him the security and privacy so he knows this data is not getting in the hands of anyone. It's his. And that was a wild one. I also have another one here in the States. I wish I could call him out because we'll probably watch this one day. You know who you are out in Salt Lake City, where I got a call going, oh my gosh, like I went to an urgent care facility 15 years ago, and if they're on Athena, actually it might have been Meditech. And I had completely forgotten about this visit. I'm for years kind of like, what happened? What did they say? And it found it. And it addressed it. And I was able to kind of go back 15 years and look at this visit and go, man, I completely had forgotten when I was traveling that this visit even happened, that this had happened to my body. And now, wow, I have the raw data. You can actually, in Savva, which kind of differentiates ourselves from other products, is that we don't just show you a chatbot. We show you, it's not just a blank screen with, okay, just trust us, it's connected in the background. Here's the visit. Here's the raw data coming from that visit 15 years ago. Now get an analysis of it. Oh, you want a second opinion? That was Gemini. Go to Grok. Now go to Claude. Now go to one of the on-device models.
Yeah, I think there's like 15 on there. It's like there's a big list. You
These
got plenty of
models
choices
every day. Like just yesterday, Google dropped a new model. And I only know that because I was on the phone with Amit today, and he was like, oh, dude, you got to update these models. And so because every couple of weeks, it seems like there's a newer, better model coming, we said, hey, man, we choose our insurance company. We choose generic versus name brand drugs. We choose our physician, give people the power of choice with these models. And maybe it's the tone. Maybe it's with how thorough that particular AI is. For whatever, maybe you think Elon Musk is a genius. Maybe you hate Elon Musk. Whatever the case may be, you don't lock this individual in. Give them the power of choice to choose between these models. And I think that's a really unique kind of selling point of Savva, is that you can use all of these leading models, including on-device ones, right? Ones that like truly, like you can be on airplane mode in a cave somewhere, and you could And you could be asking this thing questions, and it's truly on the device, never leaving the phone. I think that's one of the coolest things we're doing is the multi-model approach and letting people choose and compare in real time.
Yeah, that way you do get to continue your choice and one versus the other. And so that's awesome. So where do you go from now? Like you beta tested, have you landed a date yet when you're going to go full blown? Is it after Android, or what's the go date? The green day.
I mean, we could launch tomorrow on iOS. I will say, I think March 12th was when the beta was pushed out to everybody and a lot of physicians and key opinion leaders and people from all over. And it was inclusive, right? We were getting feedback, and the app looks completely different today than it was on March 12th. And not just bug fixes and not just using the beta as like a launch strategy. Okay, on the day we launch, maybe we'll have 2,800 users around the world that download it. I mean, ideally, that's what happens. But we've truly, Amit and I have been banging our heads against each other for a few months now going, well, this person just brought up this new feature and this new way of presenting data, and we need to change it, or vice versa. And so I don't have a date for you right now. June 3rd, I can't believe it's not launched, but the app it continues to get better and better. And so iOS, I don't think will change between now and launch date. I think we're set in stone. I think that people are happy with it. Like you said, you've had 80 sessions on it in the last month or something like that. I mean,
Yeah. I mean, I
it's
ran out of conversations today. I'm out. Like I had to go switch my module around. You know.
it's just,
Yeah.
I love hearing that, right? I mean, like, what a powerful piece of feedback that is for us. And that we're not the only one. There's been dozens of people that come and say, hey, man, when I look, the only thing we do have access to in test flight is how many sessions. We can't see anything. But some users have hundreds of sessions since March, multiple times a day logging in there. And so I don't have a concrete date for you. But
Okay.
as soon as I do, you'll be the first to know.
That'd be good. I can't wait. By the
I
way.
think maybe this month, if Android, I think we've submitted to Android as of Monday of this week because of the global kind of mission, if you will, behind what we've built at Savva. We in the States seem to be iOS people, you know, most part. If we've got Huawei and Samsung phones all over the world. We really want to have that version of the app. And honestly, there's things that are happening in Android very cool that are different than what iOS allows you to do. I think one of the main ones, when you get in and it's you're trying to find your fitness records and you're like, okay, well, right now we're reading your Garmin and your Oura ring and your glucose maybe. But we found that what Android lets us do is says, hey, we found like these 10 other apps on your phone, and just you make sure you go in there and connect that to
Yeah, that's a good feature because with the iOS, you definitely have to dig in, and it kind of says, hey, make sure you do this, and this. So that's if
yeah,
if Android does that, that definitely is a better user experience for
for
sure.
sure. I mean, because I think it's hard to communicate. Hey, we're reading this data out of Apple Health. All of these. I mean, I think we have 60 plus apps on iOS that are connected to Apple Health, but you need to do it yourself. You need to go manually into your Sleep Number app, in my case, and actually click that thing over. Versus in Android, it does it for you. But we're launching soon. I don't know, man.
That's awesome because
You
I
sound like
didn't
my
hadn't even
wife.
thought about
She's
I
always
hadn't even
asking
thought
me.
about I hadn't even thought about the diabetes thing, and that's another huge market potential opportunity where you can really make huge impact on somebody's life, man. I mean, they're, taking insulin every day and monitoring your blood sugar and making sure you're eating right and, dietary. Like, I think this app falls right in line. I know you're trying to be agnostic from a chronic disease perspective, but I do think that there are probably some chronic diseases out there or diseases that have pharmaceutical or therapeutic regimen that this is really going to benefit. Like this is really going to tie in very nicely and make an impact on the way people live every day. And I think that's what a great purpose in life to be a part of.
anything where fitness is being prescribed, right? You've got glucose and CGM. You've
Yep.
got hypertension. You've got weight loss and GLP-1s, right? And you have fitness and just the biohacker crowd as well. I think those 4 or 5 buckets, we see an incredible opportunity. You can log GLP-1 doses directly in the app and compare it to your Withings scale or your Hume scale with what your weight loss journey and when you've taken those. Same that you could do with with your glucose and being able to serve the diabetics. I mean, one of my best friends is a diabetic and has been instrumental. And he's like a biohacker, just like built like a Greek god. Takes his diabetes super seriously. We've really put a lot of time and effort into
That's great.
diabetics, definitely, and the same with hypertension. People with high blood pressure dealing with heart disease, and
Even like heart failure too. Heart failure patients need to be monitored every day. Their weight fluctuation with fluid in their lungs and their body. All kinds of really cool things, especially when you can tie in all that blood pressure, weight, salt, sodium intake. I mean, just all kinds of just crazy things like that that are really, really important. So I think you're on a pathway to something fabulous. I'm so excited for you.
thank you, Terry.
Yeah, I really am. Pretty cool. So, with that, any closing words for us, Stephen, as we break with the Zero Friction podcast as we close things down here?
I think that the average person in the States doesn't realize that modern consumer health and all these platforms that are coming out, they don't need to be HIPAA compliant with your data. I can't stress it enough. I was so surprised. If you read through the 21st Century ONC Cures Act, it's frightening what's happening around us. And so while from a, you know, democratization and from a health access perspective, these modern apps are just killer. They're amazing. Take control of your data. The majority of these actors out there, and I won't name names, but I certainly could, read some of these privacy policies. A lot of them, list insurance companies as recipients of this data. And
Wow.
I think that what I would want to convey out there to people is, we've made an architectural choice, not a policy, to never store any of this data anywhere but your phone. You delete the app, you delete a conversation in the app, it's gone. It's never reached the cloud. The app gets bigger over time as opposed to anything reaching the cloud. 23andMe taught us that, this data can end up in bankruptcy court being sold off to the highest bidder, and the highest bidder will always be a payer. We call them payer. We call insurance companies payers because they have all
Payer
the money.
pairs.
They're intelligent. They've got a lot of money, a lot of intelligent people that work at these places. So, while this trend is awesome, be weary of some of these guys playing the data game. The worst case scenario is someone looking at this data, my data that's coming out of an urgent care visit last week, say, "Hey, Steve drinks too much. He eats like awful food all the time. He's always logging. Steve's a pre-diabetic and doesn't even know he's a pre-diabetic." To have that data flow into the wrong hands, all of a sudden your family's not getting coverage, or maybe you're paying a premium for health insurance one day, and that is the scary part of consumer health in 2026. And we've taken every step possible to never even put ourselves in that position.
I think that's a great close, by the way, and great thought for everybody to leave because health apps are going to be a part of our lives forever moving forward. But you got to pick well and you got to choose well, and having that privacy, that's probably such a huge value proposition that people don't consider, that need to be really kind of moved up in that sort of messaging. So I wish you the very best. It's been a great pleasure to meet you, Stephen, and play around with the Savva app. It's been great. So we wish you the best of luck, and we look forward to big things.
Thank you for having me on Zero Friction.
All right. Thanks, Stephen. That's a wrap on Zero Friction, the show built around one simple idea: remove the barriers and the revenue will follow. If today's conversation was valuable, please subscribe and share it with somebody who needs to hear it. That's how we will grow this community. I'm Terry Kuchaluchis, Revenue Architect powered by AI. Come find me at my website, myrevrx.com, and let's talk about what friction is costing you and your organization. Until next time, keep removing the barriers and keep the revenue flowing.